Hello, my name is Dr. Glenn Feltz, and along with Dr. Kent Eichenauer, we co-created the Psychosocial Risk Factor Survey, the PRFS. The PRFS is an assessment tool that helps medical professionals to assess for psychological conditions that could affect a person's medical health. The conditions that are assessed are depression, anxiety, anger and hostility, social isolation, and emotional guardedness. This video is part of a series of videos on the PRFS, and the video you're about to see is Dr. Eichenauer demonstrating how a staff member could give interpretive results to a person based on their score on the anxiety scale.
Yeah, hi. Now I want to go over another scale with you that we have on the PRFS, the Psychosocial Risk Factor Survey. And this is the anxiety scale. Now, the anxiety scale, as you can see, your score is in the severe range here, which basically means that this is probably a pretty significant area for you. And what this test measures when we talk about anxiety, basically, there's an awful lot of kind of constant tension and worry that we might have. It's not uncommon for people to find themselves just very, having these thoughts that are going through their heads that are just really difficult to shake. Frequently, the thoughts have to do with worry, fears of things that might happen, and oftentimes things that people don't have any control over, but just sort of this kind of constant kind of dread or worry, as though it's that worry is something that we can control our happenings around us just simply by thinking about it. It's not uncommon for people to find themselves obsessing over things. There's a need to just kind of constantly keep with some of the same habits, checking behaviors, some of that. By checking behavior, what I mean is checking the stove several times to make sure it's turned off at night, or checking the doors to make sure that they're locked a number of times. One time just isn't enough. So those kind of things. And as well, there can be some physical things that people might feel, and these are things that sometimes kind of overlap with heart issues anyway, but dizziness or shortness of breath, sometimes a racing heart. Those are things that when people feel very anxious or very panicked, those are some symptoms that people might have too. And that's kind of a hard thing to kind of tease out. Okay, what's a heart issue and what's an anxiety or a panic issue? So that is something that kind of over time, and certainly by talking with your nurse or your doctor, that they can help you to try to discern what's what. So anyway, on your scale, the anxiety scale is up right there toward in that upper range. So I guess I'll ask you, does that feel like it fits for you?